Hi, I'm Dr. Walter Tom. I want to wish everybody a happy new year. And with the new year, I'm very proud to present to you a new technique that we've developed at the Aesthetic Laser and Vein Center and adapted this from many what I would call experts in the field over the last year or so, and that is a cheek and chin filler strategy to better define your jawline. Because everybody comes in and says, I don't like my jowls, I don't like my jawline. And so we're going to educate you today on how we can use fillers along with other modalities, because it's always important to know it's combination therapy. That's the best. So adding neuromodulators such as Botox and Dysport in our office, as well as maybe non-surgical percutaneous threads. In other words, threads that we can put in, thread lifts to help to pull back the skin. It doesn't replace the facelift, but a combination of these type of treatment modalities will help you to better define your jawline and help to minimize those dreaded jowls. So we're going to continue now with our presentation. Okay, so first of all, you need to understand that your success is our success. Okay, so what we need to do is listen to you. What are you looking for? So, talking to my patients over the last 20 years, I'd have to say that most of them say that they want to look more vibrant, they want to look more youthful, they want to look more attractive. And of course, that's important, I think, to all of us, really. And when we kind of get down to maybe some more anatomic specifics, what they will tell me is that they'd like to have a more model-esque like cheek as well as a more defined jawline. So what I'm going to do here now is I'm going to wave goodbye and take me off the screen. And so now you'll be able to just be able to focus on the screen itself during this presentation. And we're going to move on. So let's talk about cheeks and chin filler treatment strategies for a 30-year-old, 40-year-old, and 50-year-old patient of ours, and how to better define your jawline. So we're going to look at the cheeks, we're going to look at the filler, the type of fillers used, the amount of fillers used, as well as the chin, maybe using filler, maybe using Botox and Dysport, and the dosing that we may use, okay? Because it's important for you, because you need to know how much will it take, what will be the cost of you, what is the expectation in terms of results. So, most of you, if you've been studying cosmetics along with us, we understand that there is a triangle of beauty. And this is the classic triangle of beauty that you see that goes from cheekbone to cheekbone down to the chin. But there are actually two additional triangles of beauty. And if we were to look at the face from a more angled look, we can see that there is indeed a triangle that runs on from high up on the cheekbone down to the chin and then back to the back part of the angle of the mandible or the jawline. So we see that there is indeed these two what we call bilateral or symmetrical triangles on each side. Okay, so Scarlett Johansson is a beautiful woman, obviously, and she has the classic triangles meaning plural of beauty. When we look at her, we can see that she has, first of all, the two-dimensional or the frontal triangle of beauty with high cheekbones coming down nicely to her chin. Then, as we look at the outside or the side views of Scarlett Johansson, we can see that she indeed does have a beautiful triangle of beauty, which enhances her jawline. And we can see that very nicely here. Scarlett Johansson also has a great chin. Okay, so when we take away the circle that I had just put over there and just looking at her jawline, we see this very nice, natural looking jawline. So, what we're going to do now is we're going to start off with looking at a very pretty 30-year-old patient who's very slender. And because of that, we can see that she has some deflation of her cheek area, and we can see that in her cheek area, as well as a little bit of a shortening of her chin region. Okay, so what we want to do is to be able to help her to better define her jawline, as well as re-enhance the volume in her cheek area. So the first thing we do is we take certain types of fillers. So the fillers that I prefer would be ones that we call a high G prime or have a little bit more oomph, if you will. They're a little more vibrant in their revolumization where we inject that. So what we would do is we would use fillers such as Voluma by Allergan, the makers of Botox, as well as Restylane Define, as well as just Restylane Lift. And those would be probably the three fillers that I would use more preferentially in these areas. And so what we do is we pull up the skin in the cheek area, and we may put just maybe a tenth to 15% of a syringe in each of these areas that I've marked off on the side of the face, high up on the cheekbone area. Then what I'll do is I'll take a cannula where we'll freeze up the skin, make a little, just the tiniest little needle hole, and then we place a blunt, long tube cannula along these arrow paths, and we lay down maybe about 10% of a syringe in these areas here. And on a side view, you can see the angle at which we would inject the filler. Okay, so we can see that in before and after photos. What I did was I took one syringe and I split it between both cheeks, and then I used one syringe around the chin area. And I'm not going to describe the chin area treatment just yet, but I'll get to that in a moment. And then we did use an additional syringe in her lips because she's young. She wanted to have fuller lips, and so we went ahead and we injected her lips as well. So that's with 3 syringes of filler. So again, at an angled view, you can see that she has fuller cheeks, giving her a more vibrant look. Her jawline is more defined by adding filler in the chin area, and that by enhancing her lips, we're able to get more of a soft tissue projection of her chin, and she looks certainly more model-like, more model-esque, as I would like to say, or a more glamorous look. And once again, we can see an example here of what we can achieve with 3 syringes of filler. Now, would I have liked to have injected more filler at that time? Yes, but we have to work within the economic restrictions or framework that patients come to see us. But this is with 3 syringes of filler in a 30-year-old. I probably would, in the future, add an additional syringe of filler in each cheek area as well, and maybe even a little bit more in her chin. So we're talking about 2 or 3 more syringes. And if you can amortize this, you come in for a couple of treatments if you can't afford to do this all at once, and maybe spread this out a couple of months, maybe 2 or 3 months apart. This should give you a nice long-term result lasting a good year or so. Now, let's take a look at the chin. We can see here that the chin seems to be somewhat retracted. And what we also can see is that she has this very strong muscle right in the chin where you can kind of see the area that is very much, very much pulled up. And so what we want to use here is a combination of filler to add more volume to the chin, but also to inject it directly into that muscle to relax that muscle to give us more enhancement of the chin projection. So what I'll do with filler is first I'll start off right in the middle of the chin. And you can see where we have the 3 lower X's right on the chin itself. The midline one is where I'm going to give you most with just a simple injection there, maybe about 20, 30, 40, maybe 50% of a syringe right in that area there. And then on each side, we'll probably put about 10% of a syringe. And now what I'm also going to do, you can see there are a couple of little X injection sites in her lower lip. We're going to go ahead and we're going to inject the lower lip as well. The reason is that we want to enhance the soft tissue projection of the chin. On the same slide, if you look over to the right, you can see the thicker arrows. That's using a cannula. That's the blunt tube cannula. We're going to layer it along her jawline out to her chin to give it a little bit more projection. And then in the soft tissues, sort of in the fatty layer, right, you can see going up to her mouth. We're going to enhance that area as well with the cannula. And that's going to be important for safety reasons. Now, what about this muscle that I said is very overly active? So we're going to go ahead and we're going to inject some Botox or Dysport. In this case, we use Dysport on her. So this would be the equivalent of treating the amount of units that we use, the equivalent of maybe treating your frown line or the 11s or the glabellar area is what we call it technically anatomically. And so that's what you're going to expect. What you might pay for the frown area is what you would be paying for treating the chin area with Dysport or Botox. And we can see that that combination of filler in the lower lip, around the chin, as well as injecting that chin muscle with Dysport has significantly softened or the chin muscle contraction and has led to a nice projection of the chin, giving her once again a much prettier silhouette. Now, this is a temporal sequence. So on the left, you can see the patient before any treatment at all. Then in the middle photo, this is with just fillers. And then to the right, you can see that the patient has had filler and Dysport, which has relaxed that muscle, and you can see even a nicer cosmetic result. And most of all, what we want are happy patients. And of course, she was very happy. So the concept is putting in filler in the cheeks to lift up the cheek and better define the jawline, treating around the mouth with Botox or Dysport in the mentalis muscle or that chin muscle, and using filler around the chin as well as the lips in the appropriate dosing. It's just a quick review, and you can see a very, very nice end cosmetic result. And of course, what I like to call real live action photos. In other words, back in real life. Patients always take photos, they send it to us, so we really appreciate that. You can see that she has a beautiful jawline and a much more glamorous look. Okay, so now let's go on to a 40-year-old patient, beautiful woman. And you can see that with a combination of approximately 5 syringes of filler, using about 1.5 syringes in each cheek area, one in the lip area, and another one around the chin and the jawline, that we were able to achieve a very nice effect for her. Again, giving her high cheekbones, a better defined jawline, a softer, in this case, it's projected chin, but a softer chin that gives her a very nice silhouette. And you can see this here, especially on the side view. She, of course, was very happy. We appreciated photos that she sent to us in terms of follow-up. You can see that she's just feeling very confident. That's our mission statement, to help patients with their self-confidence by enhancing their self-image through advanced technologies in a warm, safe, and secure environment. And she sent these photos along to me. I thought she looked great, and I kind of chuckled because so did her dogs. It was pretty cute. Here's a patient of ours. I love her. She's just a very kind young lady, turning 50. She sent me these photos beforehand so that we could discuss through a virtual consultation what we might do for her. So we did a combination of approximately 5 syringes of filler. We used a combination of Voluma and Restylane Kiss, placing several syringes in each cheek area, one in the chin area. And then I also used threads. So we used a combination modality of treatments for this patient, placing threads to help to lift up the skin, to help to minimize the jowl area that she did not care for. And this is 2 days after her surgery. So that you can see she's a little bit bruised in front of the jowl area, and that's not unusual that you'll get some bruising in this area, but you can see that she has a much more vibrant look, healthier, prettier. And you can see that she has a more defined jawline. Once again, she has a more defined jawline. Then she came back to see us, and we went ahead and we added a little bit more filler for her lips and a little bit around her mouth. Here is actually me injecting back in 2017, developing this technique on our practice administrator, who is a wonderful young lady who we treated. And you can see on the screen behind, we were filming this live. This was down in San Antonio. We were using a filler going high up in the cheekbone area and bringing it down to enhance her cheeks. And this is her immediately afterwards, here in front of my colleagues, teaching them our techniques. This is a before and after photo, but more importantly, what we like is how it does, once again, help with the confidence of our patients, even our own staff. And you can see that she just looks great. Here's a young lady here who would use similar techniques of enhancing the cheek and chin area. You can see the improvement here. And what's really great with this, as she was taking it live and sending to me, you can just see the smile on her face. And once again, you can see that by injecting Botox in the chin area, it helped to soften that muscle contraction and gave her a more defined jawline, gave her a beautiful result. And once again, here's a before and after, and then a real live action shot. This is her afterwards. So you can see by adding the what we call the neuromodulators or the Botox or Dysport to relax that muscle, what a nice defined jawline she got. So I want to thank all of you for listening to our video today on how we inject chins and cheeks in terms of filler strategies, as well as using Dysport and Botox and using threads to better define the jawlines. I'm Dr. Tom. Thank you once again for listening.